And I'm muting y'all for now. We're going to start on mute. We'll have some interaction later in the meeting. So while we're just waiting a minute for other folks to come in, I want to make sure that anyone here can see when I change slides. So right now it should be the title page, coordinated human service mobility plan. Can you see when I go to the next slide, housekeeping? Thumbs up. See one thumbs up. No. Someone else shaking their head. No.
I can't see it.
I can see it.
Okay. So for those of you who can't see it, in theory, you should be able to advance the slides yourself. If you want to try like clicking or going to next, and then you can. Okay. So you see housekeeping. All right. We don't know why this is happening. It's happened on every meeting that some people can see it advance and some people can't. So what I'll do is just I will say when I'm advancing to the next slide if you'll just follow along with me. All right. All right. Yeah, we're in a couple minutes, so I'm going to go ahead and get started with the meeting today. So welcome to the Coordinated Human Service Mobility Plan, the FY25 Regional Coordination Meeting for the Northern Region. My name is Jess Maffey. I'm a Transit Programs Manager with the Virginia Department of Rail and Public Transportation. Next slide, we're going to go through a bit of housekeeping. Please do remain on mute for the presentation. I will pause. We'll pause a couple times for questions. At that point, you can use the raise hand feature and we can call on you, or you can always put your questions in the chat as we go along and we'll address them at the questions part. There's also going to be an interactive portion at the very end of the meeting, which I'll talk a little bit more about. And at that time, I'm actually going to have a list of everyone and I'll call on you each individually to unmute and just introduce yourselves so we can see who all is here. At that point, I'll also invite you to turn your cameras on. Of course, you're welcome to leave them on if you have them now. It's totally up to you. So this webinar and each regional webinar, of which there are 6, is being recorded. DRPT will post the recordings on our YouTube page and we'll send them out to all registrants. So you will actually get all of the recordings for all CHSM meetings, just in case you cross over in a different region, want to see that one. You'll get those YouTube links. You will also get these slides, which I've embedded several links within these that I'll point out to you as we go along. And those you'll be able to click on and get to the resources that we talk about. So that's all going to be available to you after this. And finally, if you are a 5310 Human Services Agency, you likely know that this meeting counts toward points on your FY25 application. So I'll have the list of everyone who's registered. So I'll know that you attended. However, if you invited anyone or, if somehow you missed the registration, just reach out to me and let me know that you were here. Going to the next slide, the meeting agenda. The first thing we're going to do right after this slide is do a quick group intro in the chat. And then after that, we're going to get into, on a high level, what is a CHSM plan? What are the federal requirements for the plan and what is the format? So that's just to give everyone an overview of what the FTA requires of us, DRPT, in creating the plan. We're then going to get into the 2022 CHSM plan creation. So that's the most recent CHSM plan that we're going to be presenting today. And it's really an update from the 2019 plan. So we're just going to recap the 2019 plan and then what's new this year. And then some recommendations for how you all can think about or use the plan. We're then going to get into the CHSM story map. So this is actually an online version of the plan we've created that we're hoping, for some of you who choose to use it, it'll be just an interactive way to use the CHSM plan. And we'll go through how to navigate that online and then the action trackers there. And I've got Grace Stankus, my coworker at DRPT here, who's going to help out with that portion of the presentation. And then finally, at the end, we'll do a little roundtable of introductions. I'll call on you each individually. And for any 5310 agencies that are planning on applying to 5310 program, we will have you just briefly talk about what you're planning on applying for this year. All right, so next slide, slide 4. I'm going to give you a few minutes to introduce yourselves in the chat. If possible, please group all this information into one message, just so my moderators can keep it straight. Please, everyone, share your name, title, organization you're with, where you're located, and your email address. If you don't want to share your email, that's fine, but this is meant to be a group sharing experience, and I'm going to send out these contacts to the whole group after this meeting, so you all have each other's contact information as well. So we'll just take a minute and let everyone fill that in the chat. All right, see some chats coming in. So I'll let you all finish up if you're still working on your intro there. And just gonna move along now to slide 5. So coordinated human services plan. I want to go into what is it, because I know some people may be new. For some people, this is old hat, but I always like to give an overview of what it is and why we're doing it. So the Coordinated Human Service Mobility Plan is a federal requirement as part of the FTA Section 5310 program, and DRPT is the lead agency for developing this plan for most of Virginia. So the FTA requires us, DRPT, to create a plan that assesses current services and transportation needs of seniors defined as people 65 years of age or older and people with disabilities. It also identifies strategies to address service gaps and set priorities for project implementation. This is meant to be a high-level kind of strategic plan on a state level, but we do drill into some specific action items that relate to these overall strategies. So that's kind of where you all come in for the most part on those action items, which we're going to get into today. The other thing to note about this is that the urbanized areas of Northern Virginia around Washington, D.C. are included in a plan developed and maintained by the Metropolitan Washington Council of Governments. MWCOG receives funding to support localities in Northern Virginia. So any locality that COG receives funding for is not eligible for funding through DRPT. So there are a few specific localities that have funding available through both COG and DRPT if those agencies cross localities as part of their service area. So I think this group is probably the one that would be most likely to be crossing with COG's service area. And any 5310s who have applied in the past probably likely know whether or not you're in both. But if that's something you have a question about, you can talk to me after the meeting. Going on to the next slide, slide 6. So according to federal regulations, the CHSM plan has to include input from the people it covers, which includes individuals with disabilities and seniors. It also has to include input from representatives from the public, private, and nonprofit transportation agencies, human service providers, and other members of the public. For the FTA, there's a strong focus at the federal level on coordination and collaboration. That's something that you'll see a lot throughout this plan, and it's really coming directly from the FTA. Obviously, we at DRPT want that too, but that's why there's such a heavy focus in the plan on coordination. The plan should bring together all the stakeholders in an area to ensure that individuals who need transportation are getting it and that services are not being duplicated within an area. So the plan follows a federally mandated update schedule, which has a minor update every 3 years and a major update every 6 years. So we just completed the minor update, which is the 2022 plan, which basically provides updated demographic data, inclusion of some new survey results, and some updates to the action tracker strategies based on those results. The next major update will be in 2025. So that's an opportunity to do a lot more public outreach and in-depth analysis of what the plan should include. Moving on to slide 7. So briefly, the format of the plan. Traditionally, it has been one document covering the entire state. It provides a summary of statewide demographics, available transportation, needs and gaps in human services transportation, and strategies to address those gaps. It also contains regional elements that address the unique challenges, needs, and goals of a single region. So we're in the northern region today, but there's 5 other regions that have their own unique challenges as well. And that was something that started with the 2019 plan, was separating the state into those 6 unique regions. And the plan really demonstrates that there are statewide challenges as well as regional specific challenges. I wanted to point out this image on the right, wherever you see this little click button icon, that's where there's a link embedded behind this image. So if you click on this, that will take you to the PDF version of the plan, and that's available to you now on our website. But as I stated earlier, the 2022 update also includes a story map version of the plan. So we've always put this plan out as a PDF and we'll continue to do so. But the story map is a function available through ArcGIS that allows you to present a narrative document while also embedding data into interactive maps to give a little bit more in-depth detail on the information that's in the plan. So we're excited to share the story map with you all today, and that's going to be part of our presentation. Moving on to slide 8. So getting into the 2022 update, to really get into that, we have to go back to 2019. Since the 2022 plan is really just an update and not an overhaul, the basis of this year's plan is very much the same as it was in 2019. So in case you weren't here in 2019, I certainly wasn't, but we just wanted to recap what was decided and created in that 2019 plan. So the first big change was that we identified 6 regions of the state that follow the Department of Medical Assistance Services regions for Medicaid providers, or DMASS regions for Medicaid. So here at the top, I've just included the DMASS map, and you can see the regions kind of divided up by these colors. And then the map at the bottom here is the CHSM region map. So we're here in the northern region. You can just see that it follows those outlines exactly. So in the 2019 plan, they conducted a study involving surveys, interviews, ride-alongs, and public meetings that identified those statewide needs and gaps in services. It was a very in-depth outreach process. They also identified underserved populations beyond 5310 that could be served better by improved mobility throughout the state. It identified gaps specific to each region and recommended strategies through an action tracker. And it also identified major statewide recommendations for coordination across all groups, including for DRPT. So this plan is really meant to encompass the whole state and all the players in it, including DRPT, and I'll talk about that in this presentation as well. Moving on to the next slide, slide 9. So to get into the 2022 update, what's similar and different? Basically, again, we built off the 2019 plan. We used the same regions, the same basic populations and providers, using seniors and individuals with disability is kind of the main group we're focusing on, since that's what the 5310 program is meant to provide transportation for. But we updated demographic information using the most recent census data and included that. We also included and analyzed both a rider and a provider survey that was new to this plan. So we worked with a VCU master's group, and they created rider and provider surveys that were administered online, and then they did some analysis of those survey results for us. So that is a big part that's included in this plan. As a result of that analysis, we ended up actually adding a new category to the action tracker based on specifically the rider results. We'll talk about that more in a bit. And then, as I sort of mentioned before, we also added a public-facing story map version of the plan to DRPT's GIS library. So here again, you see my little icon, but this is really the homepage of the story map. And the story map itself is an exact replica of the PDF, but it has all the same information included, including all the narrative portions. But it also includes these interactive maps with data that you can dig further into than a static PDF. So we're hoping this is going to be a helpful resource for you all. And I just wanted to point out, which Grace will get into this in a moment, but the way the story map is organized online, each of these blocks is like a chapter of the plan. So it follows along exactly with the PDF. All right, moving on to the next slide. I just want to take a moment here to go through, how both we at DRPT use the plan and how you all can think about using the plan. So DRPT will use the CHSM plan to guide our investments in Virginia's transportation services that are designed to meet the needs of seniors, individuals with disabilities, and other priority populations. This plan is meant to be a living document that can be updated on an ongoing basis to account for changes in technology, new transportation challenges, or transportation successes. We expect our grantees to take an active role in implementing projects that advance mobility for all Virginians and continue to support these projects to the best of our ability. This plan does not prescribe funding, nor will there ever be sufficient funding through DRPT's program to fund every recommendation. So we always recommend, organizations working to further transportation should explore funding opportunities with other local, state, and federal agencies. And that's something that's suggested through this plan as well. Getting into how you all should use the plan, could be whether you're a 5310 agency or a different type of agency that deals in transportation. The idea is there's high-level information as well as sort of practical recommendations here. So one of the things we recommend is, when you're reviewing it, if you're reading through it, you might see some challenges or opportunities that stick out to you based on what you know about your region, your partners, or even your potential partners. The first bullet here says the plan identifies statewide and cross-regional challenges. So the plan and its creation really demonstrates that a problem in one area is likely a problem in another area. There just might be a few different types of obstacles in each region. So just to give a few examples of some statewide challenges, and many of you are probably familiar with these, but the plan just kind of reinforces it. So one challenge is that there's long driving distances in rural areas. Whether you're in Southampton Roads or Big Stone Gap, you're not going to avoid those long distances. It just might be a difference of tidal flooding in Hampton Roads versus heavy snow out in the mountains. Another challenge is that public transportation doesn't always cross locality lines. We know and hear about examples of transit routes ending, and then people need to get off and walk some distance to get to a clinic or an appointment. There was one example of a cross-agency collaboration that addressed a challenge like that. That was between WADA and Hampton Roads Transit. This was not a 5310 project, but they were able to form a cooperation and use a federal grant to connect two bus lines to one medical clinic. So this is the kind of collaboration or coordination we're talking about, where two different agencies came together to kind of solve a common problem. And finally, the cost of transportation can be prohibitive for some individuals, particularly those who need more than one trip every now and then. So, considering a low-income individual who doesn't own a car but needs to get to work every day, or someone who needs dialysis 3 times a week and lives in a rural area. Again, these are all familiar sounding challenges, and the CHSM plan has many more examples, but it's just meant to show that these challenges are consistent throughout the state. Sorry, I lost my little place here. Okay, the plan also provides ideas for how agencies can seek out different sources of funding and or collaborate with other groups to provide service. So one is exploring federal funding opportunities, and that could be federal funding that DRPT is applying for, a transit agency is applying for, or a planning district commission is applying for, and it could be something that you could benefit from or collaborate on. Another suggestion here is coordinating funding across state and federal programs. So this could mean different things depending on different agencies, but one example would be, community services boards receiving general funds through the Department of Behavioral Health and Developmental Services, and potentially using some of those funds for transportation. So there could be opportunities, for example, for DRPT to work with another state agency like that to consolidate funding for transportation to shared groups. This is something that, again, these suggestions are not just for you all, they're also for us to think about how to collaborate with other state agencies. And it could be that you all have an idea for how that could work. Another opportunity that I'm sure a lot of you know about in the transit world is transportation network companies, or TNCs. So obviously there's Uber and Lyft, but there's also like Uzerve. The example here is in Richmond. GRTC is using Uzerve to augment its paratransit service, and it just kind of provides them a different method of providing service that still meets the FTA's requirements for public transit providers. And that's been pretty successful, and they've had a good experience with that. So DRPT is interested in, any agencies looking into these new technologies, or, if that's something that works for your agency, and could be good for you all to explore. Finally, getting more into the practical use of this plan. It is meant to help guide you as, particularly speaking to the human services agencies applying for 5310, help you guide you to understanding what DRPT is interested in funding. So as I said before, it doesn't prescribe what we fund, as in if you have a project that's, not perfectly aligned with the strategy that we recommend in your region, that doesn't mean it's going to be ineligible or rejected. It's just meant to give you a more in-depth picture of what DRPT has identified as important. Plus, when you do apply, you will have to fill out a couple of questions about the plan, including which of those, at least one action tracker goals that your project ties to. So, at the bare minimum, we're hoping we're asking you to review the action tracker and at least get an idea of how your organization as an individual is tying into this whole picture of transit and transportation. And finally, one of the ways to use this plan is, part of the plan is these meetings. We want to bring groups in the region together at least once a year to meet each other, put some names to faces. And obviously, we hope that the meeting or collaboration doesn't end here, but we wanted to at least provide this as a jumping off point for folks to meet each other. All right, getting into, we're going to go into the story map now. So I've gone to slide 11, but Grace here is actually going to take over and take us through navigation of the story map and where to find your region there. So go ahead, Grace.
Okay, I'm going to share my screen. Hi, everyone. I'm Grace Stankus. I'm a transit planner at DRPT, and I assisted Jess with the CHSM plan update, primarily getting it into this new story map format. So can everyone see my screen? Okay. So I know Jess sent a link to everybody, and of course, once these slides are made available, you'll also be able to access the story map through there, but I'm just going to go through another way that you can find this resource. If you go to DRPT's website, drpt.virginia.gov, and hover over our grant programs and go down to the Human Services Grant Program in the drop-down list, I'm sure you're all familiar with this page. It has all the information needed for the application process and all the programs. But if you scroll down to the bottom under application resources, we have the PDF version of the plan here. And then the third link has the story map. And so I'm going to click that. This is the main sort of landing homepage when you click on the link. And again, it has all of the same information in the same order as the PDF. So we have the introduction and go into the sort of meat of the plan, but I'm going to demo just sort of how you can navigate around the aspects of the plan that are a little different than the PDF version. So the statewide profile, again, the narrative is the same as the plan, but instead of a static map, we have a interactive map. So this has senior data throughout the entire state, and you can pan around and click on an individual county and get demographic data for that individual county here. And the maps are scalable, so as you zoom in or out, you get sort of different levels of information. So as you zoom in, you can get, I'll go up to the northern area, you can get data for the census tract level, and as you zoom out, you can see data in the pop-ups for the county level. So here we're zoomed in, and as you click, you can see the census tract data, and as you zoom out, you can see it goes back to the county. And so we have that sort of that concept with the interactive maps for the Maine 5310 recipients, senior population, and population with a disability. But we also have added other characteristics that can impact mobility. And so again, we have this in the PDF plan, but you're able to click on and off for these other groups that can also use 5310 service. And so we have zero car households. And again, same thing, as you zoom in and out, you can access the data that way. Each of these have different sort of looks for the pop-ups. Like this one has a little bit more information with this graph. And so this is just like an interesting way to interact with the data. We also have a vulnerable populations index, which was developed in a previous DRPT study. It just combines kind of 9 vulnerable groups to create an index. And so that's viewable here. And additionally, we have the veterans, internet access, and tech access demographic data. And so this is just sort of a way to drill into the data in a way that you just can't get in a paper version of the plan. And then for some general navigation, like whenever you're like finished with a chapter or you would like to move on, you can click out into a new chapter up here using these buttons, or you can go back to the main home screen at this top left, which will bring the chapter overview. I am going to go into the action tracker chapter. And so again, as the PDF, we have the definitions of and sort of just like more information about the identified gaps that were determined through the outreach. And you can click on these just to bring you to any number of the gaps. But I will go to the action tracker. Again, this is the same information as the PDF. It just is like a different way to interact with this. I think it's probably maybe more digestible because you can so you can select and filter by gaps. So if you'd like to, you know, focus on a gap that's education and training, you can click that and you'll just see the action items associated with that transportation gap. You can also filter similarly by goal. So if you'd like to improve the rider experience, you can click on that and it'll just bring up the individual action items associated with that goal. And again, this looks the same on the PDF plan. It just is sort of a different way to kind of view this data. And Jess is going to go into that a little bit more here, but finally, and what I think maybe will be most useful as you work through your applications is to focus on these regional profiles. And so if you click on this chapter, we have developed regional profiles for each of the 6 regions. And so I will click into the northern region. And as this loads, I'm just going to give a disclaimer. This looks best on like kind of a widescreen monitor. When you look at it on a laptop, things get kind of like crunched up. So like if you're able to view it on a wider screen, I would recommend that. Okay, so here in the Northern Regional Profile, we have, you know, just a summary of the region, the transit operators that currently are operating. And here we have, and this is different from the PDF, you're able to click on and off to view the transit service in the northern region. And so this, I think, will be helpful as you're, you know, coordinating with other providers just to see who's operating where. We have, you know, you can click in, there's little pop-ups. You can see, you know, certain routes, who's operating where. And I think this is just kind of a neat tool that just sort of zeroes in on the transit that is in the particular region. And so, of course, we have this and so we can see the localities that are included in COG's plan here. So really, this plan just is focusing on these outer regions. And we get into the regional demographics, which similarly to the statewide demographics, it's the same information, but this is just at the regional level. It's the same kind of like navigation with the pop-ups. You can click on and off for the seniors, populations with a disability. And then these additional demographics that again were in the statewide profile, but this just sort of zeroes in on the northern region. We have the populations in poverty, veteran status, vehicle access, internet and technology access, and then that VPI again. And then more sort of relevant to the application itself, we have these regional issues that were kind of pulled out from the 2019 outreach and then the new or continuing issues in the region from the 2022 outreach. And so this again is from the plan itself, but this kind of provides a snapshot of sort of you know, what was kind of gathered in the outreach of issues. And then we have some regional strengths. And then this again, was sort of determined through the outreach as high priority action items, things that like repeatedly came up as things to improve upon in this region. And so as you're working on your applications, you know, these might be something to focus on if that fits in with your program. And then again, just a final link to view the action tracker to bring you back there. And so we'll go back here. I realize that was a lot of information. If anybody has any questions, um, I think Jess will go into the sort of the action tracker, but any sort of questions on how to navigate or the functionality of this, um, let me know.
All right, I'm gonna go ahead and share my screen again. If you have anything come up while I'm clicking through, just let us know. And I'm just gonna go back to the screen. All right. Okay, I'm gonna just kind of pick up where Grace left off. I'm gonna go back into the action tracker. Load. So I wanted to go ahead into the statewide action tracker to kind of give you a full picture of the gaps and goals we identified for the entire state. As you saw in each region, we've identified those priority action items for each region that are all out of this list. But ultimately, your project should align with any of these goals or action items, not necessarily only the ones identified in your region. Again, you're not going to be you're not going to be rejected if you don't only do the priority ones in your region. It's just kind of to give you an idea of what our priorities are. And I am going to go ahead and read through each one of these, so that should hopefully give you an idea of how we're thinking about the gaps. However, if you want a little more understanding of how we got to those, you can always go back and read through the chapter here for a more in-depth explanation of each of those. I also do want to mention that it doesn't matter how many of the action items you list in your application. It's really not about quantity. It's about whether you can sort of justify how your project aligns with an action item. So just keep that in mind. Some of these do overlap. So you may be, mentioning two that have a similar, goal. But the idea is that you should be able to say how your project really ties into that. So like I said, I'm just going to go ahead and read through the gaps, goals, and action items here so you get an understanding of what we're looking at. So under the transportation gap trip availability, we've got expanding service availability, which includes action items like expanding after hours transportation service hours, increasing the availability of long distance trips, or expanding trip types to better meet rider needs. We've also got trip accessibility, which, it's kind of the base goal of improving access to human service transportation. So that could be providing transportation to the eligible population, those who can't use public transportation or who live in an area where it's not provided. And just want to note, you can scroll along the bottom here to read these yourselves better. I just know them pretty well by now. But the next one is enhancing scheduling, making it easier, or somehow improving access to how people find you or schedule with you. And then exploring the feasibility for expanded door-to-door service. So sometimes that's something that comes up where your clients have greater needs and you need to look at, okay, do we need to do a little bit more of that care service door to door instead of curb to curb. Trip reliability, this gap I want to pause on because this was actually the new gap that was identified as part of the 2022 update. So this really came out of after analyzing survey results from riders, which was, I think, a few hundred survey results. We were finding that the idea of a rider experience really kept coming up a lot. And it did seem to overlap with other categories here, but also have its own nuance. So words that were coming up a lot were reliability, as well as things like cleanliness, friendliness, or talking about their experiences using technology to schedule, whether that was good or bad, basically just relating to their experience overall with their trips. So, right now, some of the action items related to trip reliability are pretty similar, the same as in other categories. But the idea is that, if you indicated this on your application, you would be sort of indicating to us that there's something about the rider experience that you are trying to focus on. So again, the goal here is improving the rider experience. This could include actions like implementing standardized education and training for all of your operators to ensure they have training and resources to manage and provide aid to the passengers and that that's consistent. It could be increasing staffing so that operators can better meet their passengers' scheduling needs. So again, these were things that came up like something being late or canceled at the last minute, which we know can always happen no matter what, but just that reliability of service is what we're talking about here. And then also exploring and implementing improved public-facing technology, such as scheduling software apps that's made to be user-friendly or have those elements that for your population make it easy for them to use. again, this is not something you have to do. It's just if this is something that you're working on or is important to you and relates to your project, you can indicate that there. Moving on to the next gap of service alternatives. The goal here is expanding transportation options. So this is really mostly talking about partnership opportunities. So this could be partnering with public transportation providers to determine opportunities for efficiencies, or kind of like we talked about, maybe it's a route modification, or a deviated fixed route use, or something where you're, doing that last mile sort of connection. It could be partnering with medical or other healthcare facilities to determine how transportation can meet their client needs. It could be partnerships with community colleges or other educational facilities if they have students there with disabilities or older adults who need specialized transportation. And it also could be, continuing discussions with TNCs to determine their role in your organization, or how that aligns with what your goals are for the future of your transportation. Under the coordination gap, the goal here is increasing statewide and regional coordination. And this is really where, again, it's not just about you all, it's also about us and other partners throughout the state. So one of the ones here is working with local jurisdictions to include human services transportation into local transportation planning. So I think of that kind of as advocacy for human services transportation. It could also be, this one is more related to DRPT, or was a recommendation that came out of the 2019 plan, was developing statewide and or regional advisory committees to focus on that coordination. And this is something that was started in 2019, a statewide advisory committee that kind of went away during COVID. And, we're thinking about how that could come back, or what the outcomes of that group, would be. Could also be continuing communications with organizations involved with and supporting transportation in Virginia, such as CTAB. I'm sure a lot of you are familiar with that. There's also groups like VAM, the Virginia Association of Mobility Managers, and other groups. Education and training, this gap has the most goals and a sort of variety of goals. I think of it as the external facing, increasing of awareness, marketing, outreach, reaching out to clients, making sure that, if you serve a set client base, that people who are considering coming into your facility know that transportation is one of your services and that you provide it, or, reaching out to different kinds of populations potentially. And then you got the sort of internal education and training. So providing training for staff and riders. This could be expanded training opportunities for operators, kind of beyond maybe your basic training. If there's other specialized training that you want to implement to provide aid to passengers, or, special groups that you're serving. It could also be standardizing training for your providers or your mobility managers. That could include nationally recognized training courses or state developed courses. I think a lot of people know there's a lot of educational opportunities out there. CTAV provides a lot, and we're always looking to try to help groups get into that training. It could also be providing introductory travel trainers for new riders. That could be something you're exploring. And finally, under education and training, we've got increased safety and preparedness. Again, this came out of a 2019 plan, and it's just having an established preparedness plan for something like a pandemic. Now that we've all unfortunately experienced that, and making sure that we're prepared if anything like that were to happen again. Finally, under the final transportation gap, this is the one I think of really feeds into all the other gaps and goals, which is increasing sustainable funding streams. So some of the action items here could be, thinking about your funding for labor costs to recruit and retain operations staff. We all know that transportation agencies are having challenges with staffing throughout the country. It could be exploring and applying for alternative funding sources beyond 5310, which again, we always expect that our grantees are doing, but it could be looking at other grants that we offer, community grants, or even nationwide grants. And it would be continuing to work with local and regional government officials to explore funding opportunities through them. So, again, I consider this almost sort of advocacy work, or making sure your local government knows what you're doing in the community and seeing if there's a partnership or funding opportunity there. Okay, again, that we've gone through a lot of information, and I do want to pause here again for any questions before we get into the roundtable of introductions. So I'm going to set up my PowerPoint again, but feel free to raise your hand or chime in if you have a question right now. All right. All right. Not hearing any questions, I'm going to go ahead and go to, if you're following along, I'm going to go ahead and go to slide 13. Or, hopefully you can see I've got the slide that says roundtable introductions. I'd like to invite anyone who wishes to turn your camera on, or you can come on camera just when you speak. If not, that's totally fine too. But like I said, I'm going to call on each group or person to ask. I'm going to start with groups that I'm pretty sure I know are applying for 5310 funding. So I'll go to you guys first, and then whoever else I see on here, I'll then call on you. And if you'll just, introduce yourself, give your name, title, organization, and, you can say anything you'd like about, well, for 5310s about your project, or just, why you're joining the meeting. So let me go ahead, pull up my list here. All right. Okay, so first up, we've got Northwestern Community Services Board. Bonnie, if you'd like to introduce yourself.
Hello, I'm Bonnie, the purchasing agent with Northwestern. I've been there about a year, just recently taking on more of a role in the 5310 grant transportation. We're actually not applying this year, but I just wanted to come on to introduce myself and get to know everybody.
Great. Thank you, Bonnie. Appreciate it.
Thank you.
Next, we've got In Circle, Melissa. And Melissa, if you're talking, I cannot hear you. All right, we might come back to Melissa. She's actually been on some other regional meetings as well. All right, let's go to Shenandoah Area Agency on Aging. Bob.
Good morning. My name is Bob Haas, and we're kind of rebranding a little bit. We're calling ourselves Seniors First, so we'd be a little bit more recognizable, but officially our name is still the Shenandoah Area Agency on Aging. I'm not positive about whether we'll apply for a vehicle this year. I'm still analyzing that. I talked with Sonny Merriman this week, and the two that we've been waiting on, I think since 21, he thinks will be delivered in January or February. So
okay,
I'm going to be looking at where we are. We have over the last few years upgraded a lot of our vehicles, and we're doing pretty good. But we will be applying for operating funds for the WellTran program, which primarily focuses on individual transportation, and we've kind of had to start off with the priority being towards medical types of transportation, doctor's appointments, dialysis, cancer treatments, things that a lot of seniors or people with disabilities are just not able to manage on their own. We do work a lot with the medical centers to try to, like you have mentioned, to make sure we're not really overlapping with anyone else. We don't really find much of an overlap here. There are a lot of private transportation companies that we do work with, and we try to, if it's something that we can't meet or for some reason, a lot of times we try to help them find transportation. We really have two 5310 projects, the Well-Tran that I've talked a little bit about. We did about 6,200 rides last year. Not quite as many as I had hoped, but coming off of the pandemic, we picked up a lot. We did almost 20,100 total 5310 rides last year. That included both the Well-Tran and our senior center transportation.
Great. Thank you, Bob. And I'm sorry about saying your name wrong. I know that's that's on all of our internal. Yeah, I know. I feel bad though. I try to get the new names. It's hard sometimes. But I appreciate it. I appreciate you coming on and telling us about your program. All right, next I've got Grafton, Winchester, Elizabeth.
Hi, Jess. How you doing?
Good. How are you?
Good, good. I'm Elizabeth Colon with Grafton. I'm standing in for Tony Wilson. Tony is Grafton's Director of Facilities and Transportation. He was unable to attend today due to a prior engagement. Grafton provides solution-focused opportunities for individuals challenged by complex disabilities. The population we serve includes children and adults located in the Winchester and Richmond regions. Due to our aging fleet, we are planning on applying for one modified minivan in order to continue to provide transportation services to our clients.
All right, great. Thanks for coming on and letting us know about your project. Appreciate it. Good to see you.
Likewise.
All right, groups. I'm not as sure about whether or not you're applying or if you're just coming on, and you'll introduce yourself. Northern Shenandoah Valley Regional Commission, Becky.
Hello, everyone. I am Becky Sandretsky. I'm with the Northern Shenandoah Valley Regional Commission. I oversee our Ride Smart program as a whole, and I am filling in for Karen Taylor today as she couldn't attend. I'm not sure if we will be applying for funds this year, but in the past, I know that we have worked closely with Bob. Him and Karen have done a lot of work together. So yeah, this is very exciting. Thank you.
Yeah, thanks for coming on. Appreciate you. Next we have Loudoun County, Stacy.
Good morning, everyone. How are you?
Good morning.
Good. I am Stacy Smith. I am the Mobility Service Coordinator for Department of General Services and Transit and Community Services. I am new to the area. I'm just started position. I'm 3 weeks in, so it's good to be a part of it. So I'm the newcomer. This has been very profoundly good. It's a lot of information that I want to learn, and my biggest goal is to one, learn the Loudoun County transit system within itself, but also learn the transit systems or mobility services outside of what we offer, and see if I can kind of connect everything to make sure that this transportation is fluid for those who don't have access to it, to get out, educate myself, and also educate the community. So it's a lot here. I'm willing to just connect with people. I think I already chatted Grace like, I need tutorials. So connecting with people and building relationships, because it's very profound for me. Also get out of the community and learn more about the human services, social services, parks and rec, like all of the above within the area, and just educate, like I said, educate myself, educate others about what's out there and what we can do to make it better.
Great. Thank you so much for coming, Stacy. Really appreciate it.
Thank you. I appreciate it.
Yeah.
I'm gonna adopt all you guys as my tutorials and mentors. So look out for emails.
I was gonna say I'll be sending out this list, so everyone look out for an email from Stacy.
Yeah, that's right. Appreciate it all.
All right, thank you so much.
Mhm.
Okay, was there anyone else I missed? Anyone else want to shout out if I missed you? I think I got everyone. Again, I think Melissa from InCircle was the only one I didn't see. And it looks like she's not in the meeting. Okay, so let's just move on to the end here. I was trying to keep this to an hour and I made my goal. So I just wanted to let you know that, for those of you who are planning on applying for an FY25 application or you're thinking about it, we will have registration training hosted by DRPT on the 30th and 31st. That will be for web grants, which is our new online grant system, which will be replacing Olga for the FY25 application process. So there was an email that went out about this, kind of like from our main DRPT Gov delivery email earlier this week. But when you get these slides, I'll have links to those registrations. It'll be the exact same training on both days. It's just some options for you there. And then I've got the FY25 pre-application workshop on November 1st. So that's, an important one if you're planning on applying this year, but it will be recorded and be sent out. So if you can't make that date, you'll get that as well. And then finally, the FY25 5310 application opens on December 1st and closes on February 1st, following the same schedule as previous years. But again, this time it will be through the web grant system, and we'll be having some ongoing trainings through DRPT as an agency, because we're transitioning everyone into the system, but also through myself, obviously, for 5310 specific. So I don't have exact dates for you on all that, but those will be coming out as our team, gets all those education materials together. Finally, as I mentioned, if you'd like to connect with each other, I'm going to send out everyone who's in this meeting and their emails, that list you sent me, to the group, and you will actually get all of the contacts from each region, and because we're going to send it all out as one email after the final meeting today. Sorry, you're going to get everyone's who's participated in all the regions. Sorry, this is my 5th one of these meetings. We've got one more, so I appreciate you all hanging with me here. Finally, if you have any questions, there's my email. My name's Jess, or you can always set up a time for a call with me. But yeah, I appreciate y'all coming out today, and I'll leave you there, unless you have any last questions, but you're welcome to head out. So thank you. Thank you. Bye-bye.
Thank you. Bye.